get your medical questions answered.
Dr. Zorba Pastor is taking your calls today at 270-9933. It's a great day to call. Lines are wide open if you have a question for Zorba.
Hi, Zorba.
Hi, Zorba. Good to see you.
Hi. Good to see you guys.
But first, we want to talk about the dangers of shoveling. It seems early to be talking about that, but it's here.
Right. I mean, unfortunately, it is too early to talk about it, but that's Mother Nature in Wisconsin. That's just what it goes about. So one of the issues with shoveling snow is that people, often men, they see snow and they go, oh my gosh, I've got to take care of this right away. And if you shovel at this speed, roughly you're going one shovel like that, 4 or 5 times a minute. And if you measure how much you're actually moving, you're moving roughly 1 ton of snow in 20 or 30 minutes. It can be that much, especially when the snow is this heavy. Now, if I told you to move a ton of bricks in your yard in 20 or 30 minutes, you'd call me nuts. But when people see snow, they end up just doing too much, especially older guys. So it's very important when you're going out, when you're looking at the snow, pace yourself, take a break, realize that it's heavy, and therefore you're going to really survive this winter and basically survive life. Because we see heart attacks every single year at this time when people get out and they shovel snow too quickly, too fast, and it's too heavy.
And what are the warning signs? How do you know if you're having a heart attack?
Well, the first warning sign you often get is chest pain, but not everybody gets chest pain, especially women. Women don't necessarily get chest pain, but also chest pain, shortness of breath. Some people, it's just they go, all of a sudden, I'm just out of wind. I don't exactly know what's going on, and they have an unpleasant feeling. And remember, if you've got chest pain, where you feel a squeezing feeling like an elephant is standing on your chest, especially after you shovel snow, that's when you call 911. And one more thing about calling 911. A lot of older people say, I don't want to call the ambulance. I don't want to be bothered. I can get to the hospital quicker. And the answer is no. When the ambulance arrives, that's when you actually start the treatment. They start with oxygen. Sometimes they'll actually give aspirin and other things. So 911, taxpayer dollars well used. If you've got chest pain and you feel constricted, especially when you're doing an exercise, that's possibly the thing that will save your life.
All right, or move to Florida. Let's start with Frank.
Or move to Florida.
Let's start with Frank in Union Station. Hi, Frank. What's your question?
Yes, Dr. Zorba. I have severe COPD, and I heard there's a new treatment, the Zephyr valve. Just wondering what your thoughts are on it. Does it work?
Well, there are a number of treatments for COPD. The treatments basically are where they take part of the lung and they actually reduce the lung from its former size to a smaller size, and they make the lung more elastic and has less empty space. I guess that's really the best way to explain it. And there are different ways of doing that. One is actually, which was originated about 10 or 15 years ago, where they actually remove part of this lung. The other part is where they actually put in something that you're talking about, which is almost like a valve. Very, very useful for patients who are no longer helped by medications. And in the right hands, that can actually be a life-saving surgical procedure. Yes.
All right, very good. Let's go to John in Lake Mills. Hi, John. What's your question?
Hello, Dr. Zorba. Can you tell me about medications that can be used to shrink and enlarge the prostate?
Well, there are a number of medicines. First of all, what you want to do if you've got an enlarged prostate is make sure that actually you're getting that flow, that urine flow that works out. So there's something called tamsulosin that we often get for enlarged prostate. But there are a couple of medications. One is called Proscar, which helps shrink the prostate. And Proscar, combined with the other medications that can actually shrink it, can actually help people urinate and actually pee better. And that can actually, men can pee better and they can actually do well, and often can do well without actually having surgery. Oh. That's really the key issue.
Okay.
All right, let's go to Barb in Portage. Hi, Barb.
Hi.
Hi, what's your question?
Yeah, I was out and I walked down and took a step down, and I fell on a little bit of ice.
Oh.
Oh, terrible.
And I got hurt, but not real bad. And I just was wondering, how could somebody from not getting hurt to the point where it's real serious, but to the point where they don't get hurt real bad? And
You know, what you do when you fall down and you get hurt is you judge how bad the pain is. And if the pain is really bad, that's the time to see your doctor. Sometimes it's broken bone, sometimes it's not. It may just be a sprain, but it's very, very useful if the pain gets really bad. What you do is we call it RICE, rest, ice, elevation, compression with a compression stocking. Those are all, can make a difference in ACE wrap. So elevation, ice, and an ACE wrap can make a big difference in terms of when you fall down. And this is the time of winter when you fall down. And remember, when you fall down, you don't want to use your wrist out here because you're likely to fracture the wrist. You want to curl up in a ball and you want to try to fall on your butt because your butt is the softest place to fall and the place where you're least likely to injure yourself. Sometimes you put your hands over your head to protect your head, but don't put your wrist out.
That's exactly
right, Susan?
That's exactly what I did last winter and broke my wrist. You're so right, Zorba. Yep. Good advice.
See, that's right. You put your wrist out and then you broke your wrist. Whereas if you went like this, you would have had a black and blue mark all over. And on your butt, you may not have even noticed the black and blue mark.
All right,
now I know.
We are out of time. Thanks, everyone, for calling in. We'll do this again soon. Zorba, thank you.
Thank you, Zorba. Great to see you.
My pleasure. Take care now.
We'll have one final check of your forecast coming up.
Ready, roll playback. 3.